Hi, I'm Dr. David Hill, and today we're going to talk about behaviors in children which predict ADHD, that's Attention Deficit Hyperactivity Disorder. Now, this is a really murky topic. So if you hear me hedging on stuff, that's because the science of ADHD identification early in life is still something that we're working on. So it's going to be hard. In fact, if you get a really hard, fast, certain answer from somebody, they're probably overstating their case a little bit because this stuff remains somewhat controversial. So let's talk about how we normally diagnose attention deficit hyperactivity disorder. Well, a child needs to manifest symptoms before he or she is 6 years of age. Those symptoms should be present in a couple of places. If your child only has the behavior that you're concerned about in one place, such as school or church or home, but not in other places, chances are the problem lies in something in that environment rather than in what's going on with the child's brain. That said, we now are getting more and more concerned about ADHD in younger children. There do seem to be some children who are not yet 6, maybe they're 5, maybe they're 4, who seem to manifest behaviors that we think of as being attention deficit hyperactivity disorder. Now, why is this tough to call? Well, young kids are kind of nuts anyway. I mean, ADHD is a failure to concentrate and focus on a task for a long period of time. Specifically on a task that may not be that exciting. Anybody can focus on a video game or a TV show for a long period of time. Why? Those things are constantly changing, they're exciting, they're stimulating. Somebody says, well, I don't think my child has ADHD because he can play Mario Galaxy for 5 hours in a row. Sorry, that child may still have ADHD. That doesn't count. But as children are younger and younger, their attention spans get less and less anyway. So if somebody brings in a 3-year-old and says he's out of control, does he have ADHD? It's very hard to say. That said, there are some ADHD experts working on instruments, tools, questionnaires, exams that may be able to identify children who would benefit from ADHD treatment, medication usually, below age 6. So you might want to talk to your child's doctor about that. So we're looking again for behaviors that occur in a couple of different places. We're looking specifically for lack of focus. Just because your child misbehaves or doesn't listen doesn't mean that he or she has ADHD. Often that has to do with behavior or how behavior is being reinforced or not being reinforced. But if the child is not able to focus on things he or she needs to focus on in a setting where that's necessary in more than one place, you might bring up the possibility of ADHD with his or her doctor. So, I'm sorry this has been a little vague, but the science of it is vague, and yet we do know some important things. Behavior has to be present in more than one place. It has to manifest itself before or by 6 years of age, and it has to involve attention to things that may not be all that exciting. Beyond that, in young children, you definitely want to talk to the doctor about how they're developing and how discipline is working for you before you assume that ADHD is the problem. Talking about how to identify factors that may predict ADHD in children, I'm Dr. David Hill.